All right, guys, we're here with Ashley today, and she's going to be answering some of the most frequently asked questions about neurotoxins.
Bring it on.
First question, what is a neurotoxin?
A neurotoxin is going to be a purified protein that comes from botulinum A toxin. But again, that is purified, so no harm.
Okay, next question, who would be a good candidate?
So usually when I'm assessing a patient to decide if they're a good candidate, I'm looking for someone who either has static lines, which means when they're not moving, there's still a deep line etched in, right where the 11s are, right where the forehead is, you'll see the horizontal lines around the crows. Even sometimes you'll see some lines of pulling down of the corner of the mouth. That means they're definitely a great candidate. Also, people who have really strong muscle movement and yet their lines aren't deep yet, I can tell they're going to be, in several years. So they would also be a good candidate.
And when will I start seeing results?
Depending on the neurotoxin, see results in about 3 to 5 days, but those results take 2 to 3 weeks to peak. So even though in 3 to 5 days, you're gonna look in the mirror and be like, oh, I look really glowy and smooth, it's gonna take a full 2 to 3 weeks from the time that you're sitting in my chair to really see the full result.
And how long will my results last?
So I like to tell all of my patients that how long your results last depends on so many different things, like speed of your metabolism, if we're dosing you appropriately, which would probably be the biggest factor. So if you come sit in the chair and you have a budget, which I understand these things can get expensive, I try to educate you on if we're underdosing you based on your muscle movement, you're not going to get the longevity out of it as someone who's doing more units. So if I put 15 units here or 20 units, you're going to get a longer duration out of those 20 units than you would the 15. But generally, I like to say 3 to 4 months for most people.
Should I expect any side effects, and can I go to work after?
So this is definitely a kind of procedure you can go about your daily life right after you get out of my chair. The most common side effects people see are bruising, swelling, and redness at the injection site. Most commonly, bruising is going to be around the crow's area. It doesn't always happen, but it can, so just know that. Other than that, there really shouldn't be much side effects unless you have an allergy and we don't know about it.
And what kind of tox do you offer?
So we offer 4 different neurotoxins here. 3 of them that I have in my hand, the most popular, are going to be your everyday Botox, Dysport, which is my personal favorite, and then we also have Daxxify. Also, we have Jeuveau for those few patients that request it.
And last question, what's the recommended aftercare?
So after you get your neurotoxin treatment for 24 hours, you want to avoid sweating. So no saunas, hot tubs, working out. And then for 2 weeks, you want to avoid putting any strong pressure or any kind of deep massage on the areas injected. So you're going to want to avoid microneedling, facials, tight-fitting hats. A lot of people don't think of that, but any of that can really move the product to nearby muscles, which we want to avoid.